Hey everyone, I'm Megan with the Kieran site, and today I'm with Danae and Dr. Mruthyunjaya, and we have some really fun stuff coming to you today. We're going to have a great discussion, but first I want to tell you that this month is National Children's Eye Exam Month, as well as World Cancer Support Month. We have another 5K coming up September 28th in Los Angeles and Santa Monica. That one is going to be a lot of fun, so please join that if you can. You can also join virtually if you can't make it. We also have a great fundraiser coming up where we're going to have some really cool jewelry available that's going to be just in time for Christmas shopping. So stay tuned for that information. And I'm going to turn it over to Danae.
All right, awesome. Well, thank you so much for being here with us, Dr. M. We are thrilled to have you on, and we know you took a lot of time out of your busy schedule to try and coordinate this, and so we are so thankful for you. Um, Today, we wanted to have you come on and just help us kind of dispel some myths around eye exams this month, kind of in light of obviously Children's Eye Exam Month. So, can you just give us an idea of like what is an eye exam and what is not an eye exam?
Thank you, Megan and Danae, for having me today. It's really a pleasure. So I'm kind of putting my hat on as an ophthalmologist and eye care physician, and not just an ocular oncologist, which is where I spend time and get to work with you two. I make the analogy of going to get a routine eye exam with what we all do probably once or twice a year, which is to go and see our primary care physician for regular checkups. At that time, your medical doctor will kind of check your vital signs, your blood pressure, your height, your weight, and to see if any testing is required for any blood tests, but we'll also do an exam, the purpose of which is to be preventative, right? Is to not wait till problems occur and then to try to fix it, but to try to identify things that could be brewing that are what we would call asymptomatic or not causing troubles at the time, and then trying to get ahead of that. Now, I can have a problem, like I can have, my knees could hurt or my back can hurt or I have chest pain, and then I'll see the doctor and they can help me acutely. But the purpose of that checkup is to make sure that everything is doing okay. And the same applies to a specialized part of the body, which is the eyes. So with a regular routine eye exam, what we do in the office is similar to what you would do if you got a full physical on the rest of your body. But the eye is such a specialized organ that it really takes specialists to be able to do that. So an ophthalmologist who is a medical doctor trained in care of the eye, or an optometrist who is also trained specifically to manage eye care issues. So what happens at a routine regular eye exam is that we first take vital signs for the eye, which is to assess the vision. So that's when you read the eye chart and you kind of see how low down you can go. That's probably the most important vital sign for the eye, because it really tells us how well is somebody seeing, either with glasses or contact lenses or without. And the first and easiest thing that an eye exam is going to do is going to decide how good is that person seeing, and do they need help to see better? Like, do they need a new pair of glasses? Do they need a new pair of contact lenses? Or what they have now is good enough or adequate based on their age and their needs. The second vital sign, Danae, is checking your eye pressure. So that's that really funny time during the eye exam where there's either like a puff of air or they get really close to your eye and they feel like they're poking your eye. None of that hurts. All that is done with the eye very comfortable, and it doesn't damage the eye in any way. But that's another important vital sign for the eye. Almost like the blood pressure, when they check it on your arm, the eye pressure, though not the same thing, still gives us a sense of what the pressure is inside the eye. Because Megan, if the eye pressure is high, we worry about a condition called glaucoma, which is a potentially blinding eye condition in which high eye pressure puts pressure on the nerve that takes the message from our eyes to the brain, and can be a silent killer of vision. So it doesn't hurt necessarily, but it can cause long-term vision problems. So those are the vital signs that we kind of take from the eye. We also assess how good is your peripheral vision. So can you see things not just in the center, but off to the side? We look to see how your eye muscles are moving, like are our eyes working together or are they not working together? And then we examine the inside parts of the eye to look for various eye conditions. So that's when we use a series of different lights to examine the very front of the eye, called the cornea. We look at the lens of the eye to make sure there's no age-related changes, called cataracts. And then we examine the large inside part of the eye, called the retina. And that helps us to understand if there's any potentially vision threatening or blinding diseases. And finally, we look at the optic nerve. That's that little cord that connects the eye to the brain. And we can see the front end of that cord and to make sure that it's as healthy as it can be. So in a relatively short amount of time, we get a lot of information about not only how a patient is functioning in their everyday world with their vision, but also identifying conditions that may be causing vision problems or that might cause vision problems. And then we can only see that by carefully examining the eyes.
So one of the things that I've heard a few ophthalmologists and ocular oncologists explain about the eye is that the eye is kind of like its own organ, and so like you really do have to take care of it the same way, like, you know, that you might have your heart examined. Like you're not just going to be checking the outside parts of it. Like you check the inside, you check the outside, you check how the flow and the function of all the blood vessels are going. So I love this, and I love that you explained things like the eye pressure and the importance of having, you know, both that internal and external taken care of and evaluated. Um, do you think that there's, like, I know, you know, like Megan and I were talking about this earlier at a Cure Insight, we talk a lot on social media about the importance of a comprehensive eye exam. And I guess what we think of when we're putting that out there is we want to make sure that, you know, people are having not just the physical exam of their eyes, but also the dilation. And when I say physical exam, I'm thinking like the glaucoma pressure, or maybe just like a couple of the different tests that you described. But the dilation and specifically those imaging that can be taken, the, what is it called, the wide field retina imaging, where they can get an inside picture of the eye in addition to the dilation. So why do you think those two things are important?
Really good question. So, just like when you go to your medical doctor and they pull out their tools and their stethoscope or a light, or they'll look into your throat, or they'll, you know, kind of feel on your belly. So these are all techniques that have been refined over time to give us the most information possible. In the eye, the challenge is that it is such a small organ. And, you know, it's like a camera, a very, very specialized camera. And each part of that camera has to come together to be able to help you see. So if any part of that camera is not working quite right, then it's going to affect the picture that you get, which is your vision. So one of the most important areas of the eye is the inside part of the eyeball itself, which is the retina. The retina is like a thin film that covers the inside, as thick as maybe a wet Kleenex tissue, but that lines the inside of the eye, and that's really a part, an extension of our brain. And that's where, when light shines in, it gets processed, and that leads to vision. Underneath the retina is an area of the eye called the choroid, which is like the blood vessels that feed the eye. And think of the retina like wallpaper on your wall, and the choroid like the pipes that are located between the drywall, and the white of your eye like the siding on the outside of your house. So you need to be able to see the wallpaper, but you also need to make sure that there's nothing in the drywall that's atypical. And when we think about, in the setting of ocular melanoma, a choroidal or uveal melanoma, which is the most common location, as we know, we need to be able to see what's happening in the retina, but also, is there something underneath kind of pushing forward? To do that, we need to be able to examine all of the inside of the eye. And right now, if I were to just shine a light into your eye, Megan, your pupil gets really, really small because it doesn't like the light and it wants to make the light less uncomfortable. So suddenly shining lights makes that little hole in the middle of your iris really small. And it's hard to imagine examining like a whole world through just a small little peephole. So we have to use eye drops, which are called dilating eye drops. So there are a series of maybe 2 or 3 drops that go into each eye. And over the course of about 15 to 20 minutes, it allows that pupil to get wider and wider. And then we use a series of magnifying glasses, best way to put it, like Sherlock Holmes, very fancy. But it allows us to then examine the entire inside of the eye. Now, if you didn't use those eye drops, you may still be able to have a doctor examine a portion of the inside of the eye, but you really want every square millimeter examined, because you might say, well, it's good enough, but when we're talking about our health or screening for cancer or screening for, potentially life-threatening disease, do you really want to settle for good enough? Or
Yeah.
wouldn't you want like perfect and thorough and the best possible? That's how I look at it. So any eye care professional is trained and is able to examine the inside of your eye. There are specialists and super specialists, and that might be someone you get referred to. But the basic elements of an eye exam are what we all go to school for many, many years to be able to provide for our patients. And using the dilating eye drops really allows for a unobstructed, pure view of the inside of the eye. So it's so important, right? Because if you compromise on that, what if that little millimeter of area that you didn't get to see because the eyes were dilated was the part that's the problem? So in many conditions, and I'm not just talking about screening for eye cancer, finding any kind of abnormality in the very corners of the eye is so important. Conditions like retinal detachments or infections in the eye or other areas of weakness that could be treated in order to prevent future problems can really best be seen with a dilated eye drop. Now, there are technologic advances that make sometimes these eye exams a little bit less involved and might still give us some good information. There are special cameras that have been introduced that are pretty available across many practices that take care of people's eyes that are called ultra wide field imaging. So it uses camera technology to screen a very large portion of the inside of the eye, sometimes without having to dilate the eyes. So it can give us a pretty good, I guess, second choice, to be able to examine the inside of the eye. That is far better than no eye drops and an inability to see but a small area. Sometimes this is done as an alternative to getting your eyes dilated. I always suggest the dilated eye drop as the first, second, and third choice. If after that there was still something that prevented the eyes being dilated that particular day, or if you just had a dilated eye exam, then using the ultra wide field cameras to get a pretty darn good picture of the inside of the eye is fine. And if there's some abnormality that's seen on those pictures, then we go back to choice 1, 2, and 3, which is to put the eye drops in. Now, I'm going to say this, Danae, and I think you know this because you're very diligent with your eye exams. No one likes getting their eyes dilated. Why?
No.
Because it's really bright and it's hard to, like, especially
It's
where
hard to
you live.
drive,
And
it's hard to
yeah,
read. Yeah.
yeah, you can't read for about 6 hours afterwards because it makes the muscles that help us focus up close completely relaxed, and they're so relaxed that they can't focus up close. So when you get your eyes dilated, don't plan like a big book club meeting, like, 3 hours later,
No book
or a
club.
huge
Okay.
day at the office, like that kind of thing. Like, you do need to give yourself a little time to adjust from it. Now, you can drive home, so it doesn't really affect your distance vision, but it will be very bright. So often we'll offer little sunglasses for our patients to wear, especially when it's bright outside, like it is here in California. But also I'll tell patients, you can just kind of hang out, for a little bit afterwards and let your eyes kind of relax a little bit so that, you're not unsafe, on the road. So it's annoying, no doubt. But in a very short amount of time, we get a lot of information, and that can be helpful because just like when I go to my primary care doctor, he might listen to my heart and hear something that I am not aware of. And then he can or she can be very proactive in trying to prevent future trouble.
Oh, that makes sense. And you kind of alluded to this already, but I just want to clarify for our listeners and Megan, I don't know if you caught this, if you have any questions, but feel free to jump in. I just was going to say, can you clarify who can you see for a comprehensive eye exam? And you kind of already said this, but let's just reiterate it.
Sure. So a comprehensive eye exam can be performed by an ophthalmologist. That is a medical doctor, MD, who has trained in eye care specialties. And there are general ophthalmologists who would be where I think most of us would go to for regular eye care. Or they're specialists, but they are all ophthalmologists, so medical doctors that care for the eye. The other specialist would be an optometrist, who is a doctor of optometry. So they've gone to a special school that focuses just on the eyes. Optometrists are very adept at doing general comprehensive eye exams, also very good with getting glasses prescriptions and helping with general monitoring of eye conditions. You might have heard of an optician. So an optician is not a doctor who would examine eyes, but they specifically just work on fitting and adjusting glasses. So important, but that would not be the same as a comprehensive eye exam by either an optometrist or an ophthalmologist.
No, that's so good. Like the myth busting there, like optometrist, ophthalmologist versus the optician. Optician is not going to be able to perform the eye exam that we need.
No. They'll help you get really good glasses though, but.
So just out of curiosity, Megan, I know you have a family history of ocular melanoma, like your mom has ocular melanoma. So I'm sure you've kind of spent the majority of the last 10 or 15 years having an eye exam. However, before that point, right, before ocular melanoma was a thing, how often did you get your eyes checked?
Well, regularly, because I cannot see without contacts. So I'm in the yearly I was going every year because I needed my contact prescription updated. But since she was diagnosed, like 10-ish years ago, 12 years, something like that, I have been doing the dilated eye exam with the machine that looks in your eye. And I do still wear contacts, but I do wear dailies because those are a little bit better. So I try to be as good as I can. I try to wear sunglasses. I don't enjoy them, so it's a struggle, but I try really hard to wear them when I need to.
Yeah.
So Megan, I have a question for you. So
Yes.
when you'd go all those years and you'd get your contacts and your prescription checked, would you have your eyes dilated every single time you went for your eye exams?
Yeah.
Do you remember? So that's really good. And I'd say that might be not as common as we'd like it to be. I think a Cure Insight has done a fantastic job getting the word out about the importance of a dilated eye exam. It can happen though, that if someone is just going for, like, if you've gone, it's like your second visit this year to get your contacts changed, like that's fine. But some will go like every, like I go every year or two to get my contacts readjusted. And if everything else is good, I'm seeing well, my eye pressure is good, sometimes people will like be offered the opportunity, do you want your eyes dilated today? And then everyone's like, do I need to? Do I have,
it's like, well, obviously not.
Yeah. Like, right, why would
Nobody
you, why
wants
would
it.
you, why would you want like someone to, like draw your blood if you don't need any blood? If you're giving me the option, like I'm probably going to say no. But I think what we have to let all of our viewers and listeners know is that you have to advocate for yourself and say yes, right? Just say yes. Even if that happens once a year, once in 2 years, I'll take it. Like it's better than my patients who come in and say, well, the last time I had my eyes checked was like 5 years ago. I don't remember the last time anyone dilated my eyes. And then I'm like, lost opportunity, right? Like, maybe we
Mm-hmm.
wouldn't be in this situation right now, where we're
Mm-hmm.
dealing with so many more serious things if we had just kind of, A, gone in to get our eyes checked, and then B, opted in to have the drops put in and dilated. Now, sometimes there's medical reasons where you shouldn't get your eyes dilated. That's fine. But you're in a smaller population and you're under the care of an eye care specialist who can make those decisions for you. But for the vast majority of us, putting the drops in to get the exam is great. And adding the picture on top of it is even better because that helps to document what we're seeing. But advocate for yourself. I think that's really
Yeah.
important. And I'd say most eye
Mm-hmm.
doctors will, recommend it. Some will require it. They'll say, Danae, you really need to get your eyes dilated today because of these reasons. But don't look at it as some, like terrible thing that you're going to do to yourself. It'll be a little blurry for a couple of hours. I think that's
Yeah.
fine.
Yep. It's a really minor inconvenience for the kinds of things that you can preventatively catch early on, whether it's something not so serious or something as serious as a very rare eye cancer like we deal with in
Hmm.
a Kieran site with ocular melanoma.
Hmm.
It's really a very small consequence, a small trade. To
Hmm.
have that kind of a surety and just at least have had the opportunities to document things and to be watching what's going on with the internal health of your eye.
Yeah, and that
Um,
is part of the reason that I did it every year was because I did have a freckle that was close to a vein or on I think when they first found it it was like on the vein, but they thought it was a freckle, so we had to watch it. And the last eye appointment I had, there's a definite separation of the freckle in the vein, so they think it's fine, but again, like they take a picture every year and check it. So it's been something that they've been watching, but
yeah.
pretty sure it's a freckle at this point. But still, you gotta watch it.
So,
Absolutely.
so Dr. M, how often do you think is ideal? Like if you had your dream world where everybody who just needed a general comprehensive eye exam actually got this eye exam, how often do you think would be the most ideal for them to have this exam?
So the American Academy of Ophthalmology does recommend that anyone with any symptomatic changes in their vision immediately go get an eye exam. Um, there are various time points in our lives where vision becomes really important, or at least is assessed. We'll talk about kiddos, but it's really important, for children who can't necessarily advocate for themselves, to have their eyes checked specifically so that we can make sure that their eyes are healthy and their vision is as good and they can function well in school and in their world. When we're 18, many of us go get a driver's license. And that's another time point where our vision is checked out of abundance of caution for public safety, right? Like if I can't see, I really shouldn't be driving with a full license. I really shouldn't. So that's another point where people might identify, oh, I'm having, that there's a vision issue. But typically after the age of 50 is when everyone is recommended to have a regular routine eye exam on a yearly or every other year basis. Now, that goes against kind of what we're talking about here about being proactive and doing an eye exam to make sure your health is good. So I think this does kind of bring to question our own internal motivations for being ahead of the game in terms of doing a comprehensive eye exam. So I think that if you have either concerns regarding your general, eye health, if you have eye symptoms, a family history, something that just doesn't seem quite right, then I think it's a very easy decision to get your eyes checked. But officially, we say after the age of 50 is when routine eye exams happen because a lot of the diseases that can be very crippling for a patient's vision happen as we get older, but there's plenty that happen when they're younger too. So
Yeah.
not to ignore. Yeah.
Well, and I mean, I know like my preference, but this is also, again, just like Megan, I have had contacts and glasses since I was a child. So I
Sure.
have always gone in to have almost an annual eye exam of some capacity just to check on my prescription because sometimes, it would change rapidly when I was a kid.
Right.
And so as soon as we'd established I needed glasses, it became very important that I had an annual eye exam, if not biannual. But as far as the dilated part, I think that I remember that being something that was maybe only covered by insurance when I was a kid and a teenager. I think it was covered every 2 years. And now that I have, been developed with or been diagnosed with ocular melanoma, I wish I had just gone and had the dilated eye exam done every year,
Hmm.
as well as the pictures, because the pictures were always framed. For me, it wasn't the dilation that was the option. It was well, do you want the pictures taken or not? And
Hmm.
hearing you say like, well, this just allows us to document history. Like
Hmm.
that's what it is. You can take notes, but you're not going to see the full picture and document exactly what's there,
Yeah.
and then see, did it change or did it not?
Yeah. Now, to be clear, sometimes the pictures, depending on which practice you go to, there may be a charge, an out-of-pocket charge that
Hmm.
insurance doesn't cover for the
I mean,
pictures.
I think it was always like $35, which
Right.
realistically,
So
Yeah.
that's not
30
that
to
much.
50 bucks. Right. But for some that would be an extra charge that they don't want to consider. So I get it. So the drops kind of come as that as the included option, that you'd still
Yeah.
get the same information. Um, and sometimes the pictures are offered in lieu of the dilated eye exam. So they'll be like, oh, you don't want to get those eye drops. Why don't you just get the pictures, right? So, and again, it's easier. You don't have to necessarily get your eyes dilated. And it gives us, again, a pretty darn good view of what we need to see. But if you're asking me, is it the perfect substitution? It's not. It's a darn good one, better than nothing, but it's still not as perfect as the dilated eye exam. I'm a big
Yeah.
proponent, as you can tell.
No, that's all. I mean, that's why we need you here, is to just emphasize
Yeah.
why it's so important. Like, yes, you have options, but this is what is the most ideal. Um, okay, well, just to end, let's cover just briefly children's eye exams. So, Megan, how
Yeah.
often do you take your kids to like get, or how often did you take your kids to get their eyes checked when they were kids? I know I'm
Be
putting you on the
honest.
spot.
Well, I have not actually. I haven't, and that's a horrible. I need to because I go in to do mine because I wear contacts. They don't have vision issues, and they've been screened at school, and I have not taken them to the eye doctor. And it's been one of those things that I'm like, oh yeah, we'll do that, and then it
Yeah.
hasn't really happened. So totally my fault. I mean, obviously I'm mom, so I
Yeah.
actually am really excited to hear. Yeah,
So,
the differences and stuff because I'm your prime candidate. Tell me why I need to do it.
Tell me why the vision
so
screening at school isn't good enough.
yeah,
I know it's
Megan,
not
I
good
think
enough,
that
but yeah.
I think you're just being an honest parent, and to think about yet another appointment to arrange and take your children to,
Yeah.
let's create another 10 hours in the
Yeah,
day to
it's a
do all of
lot.
that.
Because
But
it's so busy already.
yeah, it is. Let me make
Yes.
a case. Okay, let me make a case.
Please do.
So children, at various ages are susceptible to a variety of either developmental or what we call refractive or eyeglass related issues, and some are genetic as well. Kids are resilient. They probably won't complain unless something is affecting them so profoundly that they can't eat, they can't run around, or they can't cause trouble, right? If something gets in the way of that, then you will hear about it. But if they're managing, they probably won't. And what often happens, Danae, is that you can have a child with vision problems in one eye, but their kids are so amazing and their brains are so like fluid that they can compensate for everything in the world with just the vision in one eye, and the other eye could have like poor vision, and they don't know it. They're running around, they're catching balls, they're like doing everything. They just can't tell because a, they don't know how to process it, and b, they don't know any better, and they may not know how to verbalize it. And often it's like, if they happen to kind of rub their other eye and then they realize, wait a minute, I can't see out of the other eye, then they might kind of explain it to you. So there's a lot of things that are in place and a lot of steps that are in place to try to catch that. And that's what we call vision screening. So all children, newborns, have their eyes checked when they're in the nursery. They're checking for what we call a red reflex to see that the inside coloration of the eye is similar in both eyes. They are checked to see if they blink. You'd be surprised if children have kind of um, developmental eye problems. They may not even sense light, so they never blink to lights like we do. And to see if their pupils are working. That's the best you can kind of do for a very young child. They can't read an eye chart. They can't tell you if they're seeing 20/20 or not. As they get older, when you take your children to the pediatrician, 100% of the time they're getting their eyes checked. The pediatrician's looking at the eyes with different lights, seeing if the eyes are moving correctly, if they're aligned. All these things give them hints as to whether more problems are there. Now, between about 1 year and 3 years, that's when it's kind of nebulous because the kids are running around. You can't like have them sit like in a chair and like follow directions and that type of thing. So they're kind of screened at the time that they go to see their pediatricians for the well child checkups. And sometimes they might go in front of a machine or a chart and they'll read different size like figures, not letters, but they might show like ducks and stars, and some will be big ducks,
or like
and
a
some will be
house
small
or something
ducks,
like that.
or a house. And so those are calibrated to the same size letters you and I would read at a eye doctor's office to assess our vision. When they're between about age 3 and 5, that's another time where vision needs to be screened. And that means either at the pediatrician's office, sometimes they'll have a machine that they'll kind of look into. And that to me is really a good time for children to visit with an eye doctor. Again, optometrist or ophthalmologist. It helps them first of all, get used to that type of exam, right? So they won't be scared of it. It gets used to them getting eye drops because that's part of the exam, and kids hate eye drops. But at least, like, kind of building up to it. And then also identifying as they're getting into reading age, are they seeing well in both eyes? Is one eye weak, or does one eye need glasses? Or if there's other problems, that's really a good time for that to be checked. At 5 years and older, that's when kids start going to school. And I think that's another important time point to make sure, are my kids seeing as well as they are? Because they could actually be seeing a little less than perfect 20/20, but managing just fine, right? So they're doing their thing and they're compensating and whatnot, but you want to be sure that you can assure them the best possible vision so that they can, thrive and do the things that they need to do. So at each kind of age point, it's a decision, right? Like, do we just kind of stick with what the pediatrician says? And they do a lot of checkups on our kids all over their bodies, but they're also checking eyes, and I think that's important. But you know, I usually find right around the time kids are about to go to school, somewhere between 3 and 5 and 4 and 6, is usually a productive time to have them visit with an eye doctor to assess their vision. Now, at any point, it makes sense. But if the child is either failed their screening visit with their pediatrician, or if like it wasn't a proper test and they couldn't tell, is there a problem there isn't, or if the school, when they check the vision, if there is something off, or if your child is complaining about something not being right, or you notice they're not seeing things as well as they should, all these things should prompt getting a child assessed. So that would be, again, ophthalmologist or optometrist. I'd also say that if any children have any developmental issues, learning disabilities, something that is behavioral and in component, those would be children that might even have a harder time expressing a problem. So just getting them checked probably makes a lot of sense.
Yeah, no, that makes sense. And that actually makes a lot of sense. I like how you phrased it, or how you broke it up as like, okay, like 3 to 5 is probably about the earliest that you could get them to really sit still long enough to do something, and that you might be able to introduce eye drops, kind of depending on the kid. Speaking from experience, because my youngest was 9 months old when I was diagnosed, and so within about a year of my diagnosis, all my kids started getting annual eye exams, because it makes mommy feel better. That's why.
Yeah,
And
fair.
initially, they just did a basic exam on my baby, and then it was about when she was maybe 2.5 or 3 that they first did the eye drops. And if you go to a children's ophthalmologist, which that's who I take my children to, the children's ophthalmologists are so good with the kids, and they're also really, really, really adept at doing the eye drops, doing the full dilated eye exam, even on someone as young as an infant.
Yeah,
They
they're
really have
amazing.
a lot of good techniques for doing that in the children's kind of pediatric environment. So that made a difference for me, was just finding a pediatric ophthalmologist that I could trust.
That's a great tip.
Anyway, okay, well, I
I didn't
mean, we
even know
covered
they
a
had
lot.
pediatric ophthalmologists.
Yeah, our pediatric
I didn't know
ophthalmology
that.
office here, where do we go? We go to Phoenix Children's. And so, like,
Yep.
obviously, Phoenix Children's has a lot in the way of just a lot of
Yeah.
specialties, a lot of experts. And that
So
makes it,
pediatric ophthalmologists are medical doctors who have taken extra training beyond their ophthalmology training to take care of children. So they
No.
often work with babies up to teenagers and even beyond. They're the ones that help to correct when eyes aren't aligned properly. So
yeah,
strabismus or squint, they bring that together. And even in optometry, you have optometrists that will focus on children as well. So when you call to make an appointment, say, hey, anyone that takes care of kids specifically,
yeah.
then they might be able to direct you. And as Danae mentioned, they're just good at it. Like your pediatrician can somehow engage your child,
And
to
you're
do
like,
all the
They
how
learn
things that
what
do
they
I
do.
do
works.
Yeah,
this?
how? Yeah, right. So like they're really good.
No, I love
Yeah,
it.
they probably have a
Well,
bag of tricks.
yes, a bag of tricks for sure. Or they have little toys. They have all kinds of fun little doohickeys that they like spin around and they catch kids' attention. And
Yep.
it's really, really, they're very good at their job. Um, well, Dr. M, is there anything else that you want to say just in conclusion, just as we're, kind of emphasizing? I'm actually, you know what? Let me correct this. Can you just tell our listeners, everybody who might be listening to this in the recording in any capacity, if you were just to, kind of elevator pitch, why should you get an eye exam? And you're telling someone at the grocery store or just a friend or a family member, what would you say is kind of the way to say that?
I would say that our vision is so important to everything that we do. So, in order to interact with the world around us, we want the best, most highly functioning eyes that we can get. The only way we can do that is to go in and make sure that they're running at 100%. So, go and get your eyes examined. It's easy to do. You'll learn a lot. You may actually enhance your ability to interact with the world around you, and more importantly, you might be able to prevent problems that will prevent you from enjoying vision for the rest of your life.
I love it. Well, thank you guys. Thank you to our live listeners. Thank you to everybody who's listening to the recording. Please subscribe if you have a minute. Share this with a friend and make sure that you just emphasize this month and every month why it's important to get your eyes dilated. We will see you guys next time. And Megan, do you want to say anything else to close out?
Nope, I think I'm good for today.
Oh, okay. Well, awesome.
Yeah.
And thank you again to our sponsors. We're so thankful for Castle Biosciences for sponsoring the podcast and just making sure that this can continue going. And we look forward to further sponsorship and donations helping to make sure that we can provide these free resources for all of our friends, families, and ocular melanoma patients. So we'll see you guys next time. Thanks again, Dr. M.
Take care. Thank you.